So for the committee members present, I put Sally and just write virtual next to it?
Yep.
Okay.
And I believe Joe Feltus had some kind of surgery on his foot or his leg or something. He didn't say he wasn't going to be here, but I think,
You're thinking it might be difficult for him?
yeah, or even to do it virtual. I'm not sure what the status is. I do have 6 o'clock. Dr. Bradenbach has joined us. So we have a quorum. I will call the meeting to order and certify that the open meeting law requirements have been met. If there are any people out in the public that wishes to speak, we have a time slot block put. Please call 538 or 715-538-1770. I think that's the number. Second call for anyone out in the public to call for comments, 715-538-1770.
Does anyone need an extra agenda?
And the third and final call, anyone out there in the public that wishes to speak, please call 715-538-1770. So it appears there isn't anyone out there that wants to join us tonight. We are on item number 4, approval of the agenda, and we have a 14-item agenda. We need a motion to approve.
Move to approve.
A motion made by Mr. Johnson, second by Dr. Baxa, to approve the agenda. All those in favor say aye. Aye.
Aye.
Sally, Kim, do you have it sound?
Yeah, did you not hear us?
No, I did not. I did now.
Oh.
I also said aye.
Okay.
She also said I heard it.
I didn't hear it. But, so the agenda has been approved, and Dr. Hodis has joined us also. The minutes were sent out from the April Board of Health meeting. We need a motion to approve those minutes.
I'll make a motion to approve it.
Mr. Johnson makes the motion. A second?
A second.
Okay, and Ms. Miller seconds. Any corrections or changes? Anything on the minutes? All those in favor of approving the minutes, say aye. Aye.
Aye.
Opposed? Those have been approved. Now we're moving on to number 6, the approving some WIC policies. We had an interpreter policy and a disaster policy. Kayla, are you taking that?
Yes.
Okay.
Okay, so I know, excuse me, that you all received the policies in advance, but basically the interpreter policy is just ensuring that we are providing a procedure for our language interpretation and communication assistance for all WIC participants. And it also outlines how we will be scheduling those interpreters and how appointments that need an interpreter will be scheduled. And this is all things that we have been doing for a while, but the state WIC office has now made a local policy a requirement. So it was just basically putting it onto paper, making it official. So, and I did update your correction, Beth, to say, basically I had explain of role of interpreter and change it to the. So I got that changed.
Okay.
Was there any other questions about the interpreter policy?
Kayla, I have one question on policy. An interpreter or bilingual staff member trained as an interpreter must be available. Is must a too all-inclusive word, or I was thinking of a word like should, because right now I assume it's mostly about Hispanic, but there are some dialects that even at the dental office that are different than regular Spanish and everything like that. So it becomes difficult when you say must instead of should, because there's languages, but then there's dialects that make it difficult for individuals to interpret. And so maybe instead of us providing all or must, there could be family members that understand the certain dialect. And so that must word was sort of a question word to me, and I was thinking of should.
Sure. So this policy language did come directly from the state WIC office. So I think if I changed it to should, they would maybe have some questions about that. I can definitely talk with them. You know, we do have access to the language line, and if somebody chooses to have a family member interpret, they can do that. They just have to sign a waiver for that.
Okay.
So that, I believe, is outlined in the policy as well, that they need to sign the waiver.
I just hate all-inclusive words like must.
Yeah.
Especially when there's so many languages, so many dialects, and we're getting more and more of them all the time in our county.
Yeah, I think I'll check with the state on that, but I think because it's coming down from USDA and their non-discrimination policy, if we say should, it probably wouldn't meet the USDA policy. So, but I'll check on that before we
Thank
make
you.
it official. And
Thank you.
I just realized as well, I have Appendix A as what the waiver is, and I actually didn't include it, so I'll make sure to put that waiver in there too before it's official.
That's all.
Any other questions or comments? Dr. Hodis, do you want,
Yeah, well, it's a good point, and I was agreeing.
do you have a mic by you?
Oh, yeah.
Because they can't hear you
Oh.
unless you have it
Is
on.
this working, or I?
Press the button.
Okay,
Kayla heard me.
yeah, I appreciate the dialect question. We use sometimes when we don't have a staff interpreter available, we will use Pacific interpreter, I think it's called. That does not solve the dialect problem. In fact, that makes it
Worse.
hard, because, and some of these dialects, I don't even know if we know what the formal name is, even if we said we need someone who can do this dialect. I don't think we know. It's sort of regional. But I think that the waiver, Kayla, is, that's what you do. That's what it's second best, but, because these are not medically trained interpreters, family members are just helping. But I think that you can probably dance around the must term by utilizing a waiver when it's absolutely necessary, or when the interpreter is just having a difficult time doing their job. Yeah, that's all.
And I think too, you know, it says to provide language assistance. It doesn't say to provide it, you know, in their specific dialect too. So hopefully that would keep us in the clear. But like I said, I'll check with the state WIC office on this and just see kind of their rationale behind this wording.
Okay.
Anything else?
This is Sally. We use the language line at work, and generally, if an interpreter the service we use, if the interpreter recognizes a dialect that they aren't comfortable with, they'll generally put us on hold and bring on an interpreter that has that skill set. So I don't know if you guys have, if you're using the actual language line as it's the company name, but I've used it for years, and that's what's happened. When they said, I think I need to bring another interpreter with specific dialect knowledge, within a few minutes, we've got somebody on the line providing that.
Okay. Yeah, we use, I typically use worldwide interpreters because it's paid by the state WIC office, so not coming out of local dollars. But so far I've been satisfied with their service. We don't have to use them frequently because we do have a lot of local interpreters.
Okay.
Anything else? So it sounds like we can approve the WIC interpreter policy pending attaching Appendix A and double checking with the word must with the higher above state folks. Is that correct? Then we need a motion to approve the interpreter policy with those two pending items.
I'll make a motion.
And a second?
I'll second it.
Okay, a motion by Dr. Bax and a second by Mr. Johnson to approve the WIC interpreter policy pending Appendix A and the word must for the interpreter language. All those in favor say aye.
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 Opposed? So we've passed that part. Then Kayla's going to talk about the WIC disaster policy.
Okay, so the disaster policy is something that we've had for the last several years, since I've been there at least. And it was pretty straightforward, just kind of who are the contacts we would need to get a hold of. So this one just really beefs it up, so that way it's a lot more detailed. As we have seen this past year, it's important that we have a little bit more preparedness in advance of a disaster. So I know you all received it, and hopefully it all made sense. There was a lot of state WIC policies included in the appendices. Any questions or comments with this policy?
Kayla, you said we were going to talk about, does someone go to the Buffalo County disaster meetings?
That's a good question. So currently no, but because we are merging WIC programs, if you all think that would be beneficial to attend those emergency preparedness meetings at Buffalo County, I think that's a reasonable request. If not, we could put in a comment about, following up quarterly with the, I think it's twice per year, we have scheduled WIC advisory group meeting to just talk through how things are going with the merge, make sure both participants are being served. We could just add, emergency preparedness to that meeting that happens twice a year to make sure that we know what kind of plans would occur in Buffalo County in case of an emergency.
Yeah, I'm not looking for more meetings,
Yeah, so maybe just going to the ones that already exist, like we're already planning to meet with them twice a year regardless. Maybe we can just add on updates on emergency preparedness at that meeting.
Beth, when you said the disaster committee, did you mean the local emergency planning committee?
Well, this, on the first page, it says the WIC director attends all emergency preparedness meetings at Trempealeau County. And, I was just wondering, since we're also assisting or working with Buffalo County, how do we know what their emergency preparedness meeting is? That was my
Right.
question.
Yeah, I think, I don't know if there's specific emergency preparedness within the health department meetings that are being attended, but local emergency planning committee generally has a plan that would be inclusive of departments. That's what Shriner is going to be working on. COVID committee had been working on it, but it's being handed over to the local emergency planning committee at this point. So that's probably who you would touch base with, would be their emergency management director, to find out if they have a county response plan. But yeah, maybe to become compliant, you could consult with Dustin Stevens and or Dan Shriner. Just to see where all this stuff plugs in. But yeah, emergency preparedness is part of the mandate of the health department, and public health certainly jumped in this year, so baptism by fire. But yeah, so if that's what you're referring to, yeah, that would be LAPC, and that would be a good person to talk to with Shriner, because he's going to be enhancing our current emergency response plan, our ERP.
Okay, I would point out that our WIC director has been very, very involved in our activities this year regarding COVID.
Any other questions?
I guess I'm still a little confused on what we'd like to see moving forward, because, I mean, right now, obviously, I take part in, the emergency preparedness meetings and trainings within the health department, but I've never been, is it LAPC you said, right, Sally? I've never been to those meetings at all. Is that something that we feel the WIC director needs to be attending, or just the health department ones?
And I think, yeah, you wouldn't have. The public health director is a member of the LEPC anyway, and that's why I wasn't sure, because that's already, Barb is already an active participant in that committee, Sherry before her, so the health department is represented and public health is represented in it. They're probably just looking for, yeah, they just want something that says, now that, in emergency management, you respond to the disaster. It came out of nowhere, it caught you off guard, you respond. Once you get to the point where you've responded, then you start getting into mitigation, and then from there you start saying, okay, now that we've figured out this can happen, going forward, what do we need to do to prepare for it next time? That's where everybody's kind of at right now, is okay, where do we do going forward to prepare for it next time? This policy reads kind of like what we need to do is, okay, in the event this happens again, what did we learn and such. So Barb, public health director, is already part of that committee, and so that's fine. I've never known anybody other than the public health director or a designee to attend those meetings. I was the chair of that committee for just about 10 years and served on one in another state, in another county. So public health is always a part of that committee, so.
Okay, so how about so this is the pre-event planning number 1. We say WIC director attends all emergency preparedness meetings at Trempealeau County Local Health Department and receives updates from Buffalo County Local Health Department biannually.
That sounds good to me.
Yep, sounds good to me too.
Okay.
Are
Great.
you ready?
Any other? Yep, I got it down. Carol, I'll send you the e-docs when we're done.
Carol's not here,
Carol's
you're
not
stuck
here.
with me.
Oh, okay. All right, I got it all. I'll send it off when they're all done.
I'll say Carol C. Kayla.
Yeah, we can't see you guys. Usually we can see you, but
Oh,
Yeah, we have no video of the boardroom.
huh. Well, Daryl was here instead of, but that's okay, you don't need to see me.
No.
As long as we can hear,
You don't need to
as long
see
as we
us.
can hear.
Anything else on the disaster policy, the WIC disaster policy? Then we need a motion to approve.
Approve with the changes?
Yes, approve with thank you, with the changes that Kayla is going to put in about seeing Buffalo County, what'd you say, semi-annually?
biannual.
Biannual? Okay.
I'll make a motion to approve.
Okay, Johnson makes the motion to approve. Now we need a second.
I'll second.
Dr. Bradenbach. Any other discussion? All those in favor of approving the WIC disaster policy with the change to meet biannually with Buffalo County, say aye. Aye.
Aye.
Opposed? And that one passes also. Kayla, I think you're up on number 7, too. Update on Trempealeau Buffalo County WIC merger and a review of the WIC staff and scheduling.
Yeah, so the merge has been going really well. I've been getting a lot of work done this past month. I'd encourage you all to check out our website. My dietetic intern helped to get that ready to go. So the website now has everything with our new logo, Trempealeau Buffalo WIC, and just some, kind of gave it a facelift with some new documents, an easier to access application, and I've got some brochures on the way as well, so we can start doing some outreach to just kind of notify our partners in the 2 counties that we will be merging, and we will still provide the same services. It's just, we'll have a new phone number, a new email, basically. So kind of working on that as well, getting the phones all situated, getting rid of the extras. Worked with Buffalo County already on removing their 2 phones, which is nice because they have a different cellular provider, so we don't have to transfer any phones over, which definitely makes life easier. But I mean, overall, it's going really well, making some headway. We do have a new staff member starting on June 1st. Caitlin Niebuhr, I think is how you say her last name. So I'm really excited to have her get started. I think she's going to do really well in the position. It was really hard to pick one person to hire. There were a lot of great applicants, but I think she will be the best fit. So I'm looking forward to getting her trained in. As far as clinic locations, we aren't getting rid of any locations with the merge, so we will have the ones we've already had in Trempealeau County with Whitehall, Arcadia, Galesville, and Osseo, and then adding Alma and Mondovi. I did a slight adjustment to the Alma and Mondovi hours because previously those were all like 8 a.m. to 5 p.m. And just with adding them onto our normal clinic schedule, I felt that was too lengthy of hours and could lead to some more burnout with the really long days, with including clinic setup and takedown. So we adjusted to one day in Alma would be 8:30 a.m. to 3:30 p.m. The other day would be 10:30 to 5:30, and then same thing for Mondovi. So a day with late and a day with early. And of course, we will kind of assess how things are going and adjust as needed. So if things are not going well, if that's not meeting our participants' needs, then we will make some changes. Let's see here.
Yeah, have we met since Nanishka joined us? I'm getting.
I think so.
I don't think so.
No, okay. Would you go ahead and introduce her?
Yeah, sure. So Nanishka, she is our new public health technician. She started, I think it was the first week in April. So she's been doing really well. She's fully trained on all of her WIC duties and is moving into the public health duties now. So she's definitely a go-getter, has great time management, and is very motivated. So she's been doing a great job, and I think our team will be fully staffed here pretty soon, which is very exciting. I'm looking forward to that time. Also, I will be starting up in-person clinics as an option in July for WIC participants. It's not required, so I won't be making anybody come in, but it is an option. Just hoping to get the new staff trained, so that way when we do resume in person, we're back into the full swing of things. They can kind of slowly ease themselves into it by just kind of starting with a handful of people at the clinic versus an entire full clinic day. So looking forward to seeing people in person again and getting some of those heights and weights done that we have been not getting for over a year. So hopefully we'll be able to catch any kids who are maybe not meeting their milestones. So I think that's all I have. Is there any specific questions anyone has about the new staffing or the merge?
Yeah, Dr. Hodis has something.
Yeah, Kayla, that's a lot of good work. I have a question, maybe it's silly, but if a patient, or if a person, a client from Trempealeau County wants to go to the website, and that it's really great that that's being updated, if they type in, they want to know more about it, and they type in Trempealeau County WIC, will that go to the combined Trempealeau Buffalo, or do they have to say Trempealeau Buffalo? I'm just wondering what's the key.
Like if they Google search it, you mean?
Yeah, like, will that
Or,
just automatically tell them that it's a combined WIC website?
Sorry about that. My Google Home just was talking. So, can you repeat your question, Dr. Hodis?
Yeah, if somebody is saying, I live in Trempealeau County, I want to go to the Trempealeau County WIC site, the website, in the newly updated version, which is the combined one, are they going to get to the combined website, which has been modified and refined, or is it like a dead end? Do they need to know that it's Trempealeau and Buffalo combined? I don't know. I mean,
Dr.
maybe-
Hodis, I just tested it while you were talking, and I put in Trempealeau County WIC,
Yeah.
and it brought me to the Trempealeau County webpage, but once I got there, it says Trempealeau Buffalo County.
Okay, great. Thanks.
Thanks, Kim. I think it also kind of depends on your search engine, because just the other day my colleague in Eau Claire County was having a hard time finding our food pantry list. And I was talking to Kathy from IT about it, and we realized that, well, she was using Microsoft Edge, which apparently has a terrible search engine. So, but I will make sure, I haven't gotten the Buffalo County website updated, but when I do that, I'll make sure that it has all of the same information. So even if someone gets directed to the Buffalo County website, they will still be able to apply and know that it's like a combined project. Because I'm sure that there's a lot of resources out there that are going to have the Buffalo County website listed, and it's going to be impossible to find all of those places. I'm thinking especially like national things like the National WIC Association, or there's some weird like WIC website where if you just search you can like find all of the WIC programs, but it's not like official. So I'll make sure that the Buffalo County website has all this information and a direct link to our website too, so that way if people get directed there, they know where to go.
Yeah, I think it may be a bigger problem for the Buffalo County residents to just, as you said, to make sure that if they get to Buffalo County's health department webpage, that it directs them back to us. Because right now it has a phone number, which is, I'm guessing, one of the phone numbers you're getting rid of as you merge the two programs.
Yeah, the Buffalo County site. Yeah.
Yep.
And we'll be sending out a mass text message, email, mail, depending on people's communication preferences, on all of this updated phone numbers, the new clinic schedule, etc. So everyone, all current participants are aware of what is happening.
Anything else? Thanks, Kayla.
I think I might be the next agenda item too.
Okay. Oh, yeah, approval of the WIC MOU. I thought you could go home.
Yes. I got a lot of things tonight for you guys.
Number 8 is reviewing our MOU with Buffalo County Health and Human Services, the public health nursing, and the approval of our WIC MOU.
Okay, so with the the state WIC program does have MOUs with certain programs that are across the state. So an example of that is the immunization program. So we do have an MOU to, basically we have access to check their immunizations directly in our charting system to make sure that they're up to date and to advise them on how to get in contact with their provider or the health department to get up to date on our vaccines. However, if you want to do a MOU with a local program, you have to go ahead and get that other MOU written up. So this is something that Buffalo WIC had already with Buffalo County Health and Human Services. So they had the reproductive health planning, reproductive health family planning, and public health nursing programs. They already had these MOUs in place. So all I did was just put this from their policy and procedure format into ours with both the policy and procedure and the MOU, and made some changes to make sure that it says, Trempealeau Buffalo WIC, and specifies this is for Buffalo County Health and Human Services. And I will be meeting with their health officer next week just to discuss the nitty-gritty details of how we are going to make those referrals for those programs.
So
Any questions or
are you
concerns
saying
about
we need
those?
to wait to approve the WIC MOU until the next meeting?
Nope, it should be good to go.
Okay.
Because it does say that we will provide the information to the appropriate Buffalo County Health and Human Services staff. I'm just gonna go through a little bit more details with them to make sure I've got it all ironed out before, sooner rather than later.
So then we would need a motion to approve the WIC MOU with Buffalo County,
I'll make a motion to approve the WIC MOU with Buffalo County.
and a second.
I'll second it.
A motion by Dr. Baxa, seconded by Mr. Johnson, to approve the WIC MOU. Any further discussion? All those in favor say aye.
Aye.
Aye. Opposed? Good job, Kayla. Are you hanging around because you want to stick till the end, or can you go home now?
I think I'm gonna go home now.
That
Thanks
sounds
all, I
good.
appreciate it.
Okay.
Thank you for all your hard work.
Thanks,
Thanks,
everyone.
Kayla.
Have a good night. Bye.
Item number 9 is probably with Barb then. Review and update on our COVID status and department issues, testing, school update, and vaccine distribution.
The last testing that we did with the National Guard, there was only 4 people that showed up. That's going to be our last National Guard testing. It's just not cost effective to do that. We still have Randy Arneson, who will do testing by appointment, and she's fairly flexible about when those appointments are. School update. When we approached the schools and asked them what their thoughts were in terms of doing COVID shots for the newest group of kids who became eligible for COVID vaccine, which means now from 12 until 18 would be eligible. Only 2 schools showed any interest at all in it. One of our partners, Gunderson, is going to go ahead and do those things for us. They're going to schedule and do the shots at both schools. Let's see. We have another vaccine distribution tomorrow. It's at the annex. For most of the group, it's going to be second shots on the Pfizer vaccine. We have some that are coming in for first shot of, actually an only shot of Johnson & Johnson, a very small proportion of it, but we're having trouble filling our appointment slots. right now, I don't have any clinics scheduled beyond tomorrow. We are reaching out heavily into the Hispanic community. I believe one of the Hispanic pastors is coming tomorrow with his wife for his vaccine, and where there is a picnic coming up this weekend that it's my understanding that he's going to be promoting the vaccines for. But I would tell you that we're the only ones that can't get people to sign up, but that's not true. It's down all over. So at this point, like I said, from the health department, we're kind of on hold, hoping that we can get out and actually do some out in the Hispanic community. There's some discussion on whether or not we would actually go out there at an event where they would sign up for appointments beforehand, or whether those people would come to the annex. Right now, like I said, it's all in discussion. Any questions, thoughts?
Barb, if somebody wanted to, like you just said, you're having a hard time filling on the slots. You have slots open tomorrow?
We do. I'm not sure how much. We do have some extra. I think we filled the Pfizer. We do have some extras from the Johnson & Johnson vaccine, I believe.
So people could call the health department in the morning? Is that how that would work?
They could try if we have enough vaccine to cover it. The vaccine there's all kinds of prep involved in the vaccine, so depending upon when and what time they wanted to come. Right now, we're not going to start shots until 1 o'clock. And based upon the number of people we have, we're planning on ending up around 3 or 3:30, including both vaccines. Johnson & Johnson, you have to have in an arm 2 hours after you pierce the stopper. So having a Johnson & Johnson at 1 o'clock and another one come in at 4 o'clock isn't going to make it.
Okay.
The vaccines are very hard. They're not going to lose anything by calling, and we might be able to set them up with something else. We may end up with a partial vial. At this point in time, I don't really know, because we can't really predict who of the people who have appointments will actually show up.
Okay, thank you.
Any other questions?
Then we can move on to number 10, approving the immunization policy for minors.
Okay, there isn't, and I didn't get it done. We're going to probably have to table it for next month. But what we have is an immunization policy for VFC, which stands for Vaccines for Children, which requires a parent to be present. Perfectly logical. It requires identification, so we know the adult with the child is actually the parent of the child. We have a history of kids coming in with aunts, uncles, older brothers, people who cannot legally sign for the vaccine. And what I wanted to throw out the idea of, if we are interested in making it a little bit more liberal for the COVID vaccine only. The VFC policy would stay as is. We have parents who can't spell their children's name according to the birth certificate. We have parents who can't get their children's birth date correct. And at the same time, we have the state absolutely demanding that everything be perfect on the WIR, which is Wisconsin Immunization Registry. And it becomes a hard thing to manage, which is why we started asking for it, to make sure that we have the right people with the kid. And that by having documentation, we have something that's spelled correctly, theoretically. But anyways, that's what the discussion was going to be, is do we want to relax it a little bit, like maybe, paperwork or something, for COVID only. So right now, I said I didn't bring it. I have it put together. I'm getting one person shaking their head no. So just, if you think about it until next month. There's pros and cons to it. And that's all I had to say on that.
Okay. Now we come to item 11, which is maybe a good thing, maybe a bad thing.
Well,
Retirement of the Director Health Officer, approval of an
me.
acting Director Health Officer, and approval of recruitment and hire of Director Health Officer.
so let's start at the beginning. It's my intention to retire here, and I am officially handing you
The
a
letter.
retirement letter.
Do I read it?
You can?
Okay, because this will probably be for everyone's knowledge. So it's official, it's dated yesterday, May 17th, to the Trempealeau County Board of Health. This letter is to inform you of my intention to retire as Director Health Officer for the Trempealeau County Health Department. My retirement will become effective the end of July, with my last working day being July 30th of 2021. I have served the residents of Trempealeau County since 2007, starting as a public health nurse and most recently as the Director Health Officer. The mission of the Health Department is to promote and improve the quality of life and health of all people in Trempealeau County through community assessment and surveillance, disaster planning, disease prevention, and health promotion in the areas of nursing, environmental health and nutrition. I have found my service to be deeply rewarding and tried to support our mission to the residents of our county. The Board of Health and County Board have provided excellent guidance and support for the Health Department's efforts in providing services to the community. The importance of an independent public health department has been highlighted this past year during the health crisis created by the COVID-19 virus and the multiple challenges it forces on us. The Health Department has reinforced its partnerships with many organizations within our county and with counterparts in other counties and at the state level. I've been blessed with an excellent staff in the Health Department. Their efforts and dedication have made a positive impact in protecting the residents of our county in both normal and these challenging times. I will miss working with them on a daily basis immensely. I regret that the pandemic did not allow us to celebrate our 100th anniversary as an independent health department, which was founded in 1920. Maybe a celebration later this fall or next year. Thank you for allowing me to serve as public health nurse and Director Health Officer. While I am leaving, my heart will remain here. Sincerely, Barb Barzak, PHN, Director Health Officer. Silence in the room.
It's official.
Barb?
Yes.
I remember I wrote, when Barb first started, I wrote a story. I was working for the Galesville newspaper. And then she and I got to respond to flooding in Arcadia, setting up a shelter, and literally worked around the clock trying to respond to public health needs, people needing medication. I've got a few battle stories with her, and so certainly COVID. I am in awe of her strength and the times that she did not tell people to go jump in the lake this past year when I would have and was on the verge of doing so, showed her stoicism and her control and a calm, quiet voice in the middle of a pandemic storm.
I will confess I thought about it.
I know you did. The fact that you didn't do it was the strength part that I admired, because everybody knows I did not have that same strength at times. But I'm moved. I've been emotional since I read it, just because you were subject to abuse that you didn't deserve this past year, but you continued to serve this county with compassion and love and patience. And I don't know that many people outside of the courthouse will really fully appreciate what a tremendous leader you were. You were a general in a battle, and I don't think people really appreciated it. So I want you to know that I recognize that, and you will be missed.
Thank you. But I have to tell you that this is not something I could have done by my own. I had a wonderful team upstairs.
But good people stay when they have good leaders.
You keep that up and I'm not going to be able to get out the door. My head will be so big.
So now we need to hold back tears and kind of look to the future. What are you thinking as far as what's going to happen
Okay.
between now and
Well,
when we'll be able to find someone to replace you?
okay. What I was thinking is you want to just go ahead and start the search to authorize the recruitment and, hiring of the director so you can get it going. I've given you basically 2.5 months to try to do this. And I'm thinking that you may also want to think about and possibly name an interim director that can spend some time with me while I'm still here. As much extra, if we have extra time, but I'm not quite sure where that is because I've never found it. But at least get her feet wet upstairs. I'm trying to say, I want to say his and her, but the only his hasn't been there long enough. The rest of them are all hers. And we've got a couple of very qualified people upstairs that would do an excellent job. And so the question is, what is your pleasure? One, I'm asking you to approve the search for and the hiring of my replacement. And then I'm asking your thoughts on naming an interim director that will, take over until you have a new one in place.
Well, I
Barb?
think the discussion of an interim probably needs to be done in a closed session, since we would have to discuss personality, qualities and such, so.
Okay?
Also, you would probably, since Barb, you know most of the hers that are been working with you, and if you were to give our chairperson a letter or a recommendation in an envelope that who you feel would be an excellent choice and who would be Plan B, I think that would be, because I don't think any of the board members know the ins and outs of it day in and day out, who you think would be a qualified acting director.
Okay?
Then we would probably have, I don't know if we want to wait till next month's meeting. Would it make sense, or,
Barb can send you or email you in private, and I would say to have, give it to Beth,
Okay?
and then it'd be up to you, Beth, as far as contacting us and meeting, or,
Sally, what are your thoughts?
Yeah.
You have more experience than I do in this kind of thing.
Probably add it to the next month's agenda as a closed session item. Then we
Okay.
can talk, we can't talk openly about an employee.
No.
Right.
And so if we go into closed session, this would be an appropriate exemption for that, and then we can have that conversation. If it's somebody who already works there, is already familiar with it, then having, waiting this extra month also gives Barb a chance to kind of have her mindset looking at things through different eyes maybe, but I would say put it on the agenda for closed session next month.
Okay. And then, do I contact HR and have them, put out the advertisement for the new Director Health Officer?
Yeah, I suppose you could. I usually, I don't know, the chairs usually, or committee chairs do that, but you could, I think. Otherwise, Barb, if you just let her know, because you have to turn your resignation into her anyway, or your retirement, right?
That's correct. I made them a copy of the letter that I just gave Beth.
So they're probably just waiting for us to take the vote, and then they'll move.
So do we take a vote tonight to advertise the position?
I think that's a good idea to get it moving.
Yeah, I think so.
So then we would need a motion to have Barb contact HR and have them start advertising for the new Director Health Officer.
I'll make that a motion.
Right, we've got two separate bullet points here, so if we do them separately, then it's not confusing.
You mean
So-
having Barb tell them to advertise for the new Director Health Officer?
Yeah, it's listed as an action item, so I'll make a motion to approve the recruitment of a Director, a Health Officer, which would include, yes, HR being notified to start the process.
Okay, would you repeat the motion again? Because Barb and I are trying to write it down since Carol's not here.
It's same wording as the bullet point, approve the recruitment and hire of a Director and Health Officer.
Okay. And I believe Ron seconded it.
Yes.
Sally made the motion, Ron seconded to approve the recruitment and hire a Director and Health Officer. Any further discussion? All those in favor say aye.
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 Opposed? Okay, and then, as far as the interim goes, we'll talk about that next month. And, in the meantime, Barb will give me some insight secretly, and then I will, relay to you folks. Not by all, reply all kind of thing. We don't want to get into an open meetings thing, but,
Probably, let's just save the naming of whoever it is for the meeting next month, and then we don't have it moving through the internet channels.
well, I was thinking a phone call,
Yeah.
but,
And the closed session.
yeah, during the closed session.
Yeah, during the closed session. I think that's fine to do it then, yeah.
Okay. Good thing Sally is so knowledgeable and experienced. Then I think number 11,
That was 11.
yep, we can move on.
Mm-hmm.
Carol has left the agency vouchers and budget with us. Do you want to tell everybody kind of the good news on why Carol isn't here? Because it's not that she is ill or anything, she has a big celebration tonight.
Actually, what I was thinking, it would be her news to share.
But that will be not till next month
But it's something fun and exciting.
Yeah.
I just wanted you to know that.
for her father-in-law. Yeah.
Okay.
Okay, on the vouchers, there's really nothing big going on. We're still processing, I'm reading from Carol's note here. There's nothing big going on, still processing vouchers for COVID tracers and nurses giving shots. Since the last Board of Health meeting, $18,422.94 was paid out in vouchers. Does
That's all
anybody-
money we have to recover, right? Through
Yes.
COVID funding and FEMA, correct?
Yeah, according to current calculations, I'll end up leaving some COVID money on the table. So yes, it's all covered.
Any questions about the voucher report or the budget? Then if you look at your calendars for our next Board of Health meeting, should be June 15th, the third Tuesday, at 6 o'clock. That works for everyone? Okay, we'll set that. And we've hit the end of the agenda, so I will adjourn the meeting at 6:54. Thank you, everyone, for coming and your input.
Thank you, Beth.
I look forward to coming to this meeting because I know people are happy and it's not going to be a long, dragged-out affair. Thank you.
Have a good evening, everyone.